Cardiologist warns, never take B12 with these two common medications after 60. Seniors, if you take vitamin B12 every morning, stop and listen to this before taking your next dose. Right now, as you watch this, something is happening within millions of seniors across the country that causes no pain. There's no dizziness or chest tightness, nothing that would make you put down your coffee and call your doctor. And yet, it is silently raising the risk of stroke and heart damage in people who are doing everything they think is right. One of the most trusted supplements on the shelf, vitamin B12, is creating a danger when it pairs with the wrong medication. And here's what your doctor probably hasn't told you. When high doses of B12 are combined with one of two common medications, a molecule called homocysteine is created that acts like sandpaper on the inner walls of your arteries, increasing your risk of stroke several times over. Today, I'll reveal which two medications are dangerous to combine with B12 after age 60, and how to protect yourself exactly. Before we start, leave a comment and tell me where you're watching from. Hit the subscribe button and turn on notifications, because I share vital health information like this every week. Now type your age in the comments right now, just your age, because what I'm about to share affects people differently depending on how long you've been taking these medications. Here's something worth knowing before we dive in. A study published in the Journal of the American Medical Association found that seniors taking high doses of B vitamins, including B12, over a prolonged period, actually showed a higher cardiovascular risk under certain conditions compared to those taking lower doses. It didn't decrease, it increased. That finding surprised many in the medical field, but when you understand the mechanism, it makes perfect sense. Let me tell you about Dorothy. Dorothy was 71, very sharp, a retired teacher. She walked every morning and took a handful of supplements every day with breakfast because she had read that after 60, the body stops absorbing nutrients as well as it used to. B12 was high on that list. She was proud of being proactive. What Dorothy didn't know was that she had been taking metformin for type 2 diabetes for almost 8 years. And for 8 years, no one had sat down with her to explain what metformin does to B12 absorption over time, or what happens when the body tries to compensate. Her daughter noticed Dorothy had been feeling more tired than usual for the past few months. Not a sleepy tiredness, but an exhaustion that sleep wouldn't fix. Dorothy told herself it was age. When blood work was done, including her homocysteine level, the results showed what was becoming a common pattern. Her homocysteine was dangerously elevated. Her B12 levels were actually high from the supplements, but the two together told a story of silent vascular damage that had been accumulating for years while Dorothy did everything she thought was right. Comment Dorothy if this story sounds familiar to you. Let me explain exactly what's happening in the body and why the combination of B12 and these two medications creates a problem that standard checkups almost never catch. The first medication is metformin. If you have type 2 diabetes, there's a very good chance you are taking it. It's one of the most prescribed medications in our country for blood sugar control. It's genuinely effective, but metformin has a side effect that most patients never hear clearly. Over time, especially over the years, metformin interferes with something called intrinsic factor in your gut. Intrinsic factor is a protein that your stomach produces, and it acts as a delivery vehicle for B12. Think of it like a taxi. B12 hops into the taxi, and the taxi takes it where it needs to go in your bloodstream. Metformin silently damages that taxi system, makes it less reliable, less consistent. So your doctor sees low B12 levels and says, take a supplement. And you do. You go and buy a high-dose B12 tablet, because more feels like better. For a while, your blood B12 levels go up, and your doctor says everything is fine. But here's what that blood level isn't showing you. It's not showing you what's happening downstream. That when B12 can't be processed and transported properly due to damage to the intrinsic factor system, it starts to interact with another molecule in your blood called homocysteine. And homocysteine is where things get truly dangerous. Homocysteine is an amino acid your body produces naturally. In small amounts, it's harmless. Your body uses B vitamins, including B12, B6, and folate, to convert it into something useful, and clear it from your bloodstream. But when that conversion process is interrupted because B12 isn't being absorbed or processed correctly, homocysteine builds up. Elevated homocysteine in the blood does something very specific and very damaging. It acts like sandpaper on the inner walls of your arteries. Hit the like button if this explanation is helping you understand what's happening in your body. A research team from Harvard Medical School described it this way. Elevated homocysteine doesn't cause a sudden blockage like a clot does. It causes chronic abrasion. It inflames the arterial wall, makes it stiff. It makes it easier for plaques to form and harder for the vessel to expand and contract as a healthy artery should. Think of your arteries like a flexible rubber hose. When they're healthy, they stretch and recoil with every heartbeat. When homocysteine has been scraping those walls for months or years, the hose looks more like a rigid plastic pipe. And rigid pipes crack. They don't flex under pressure. They break. In the cardiovascular system, a break like that is a stroke or a cardiac event. How many of you have been taking metformin for over 3 years and also take B12 supplements? Be honest with yourselves right now, because this combination is happening in people's bodies every single day, and almost no one is connecting the dots. Now, the second medication I need to tell you about is one that even more people take, and its interaction with B12 is different than metformin's, but in some ways even more unpredictable. These are proton pump inhibitors, commonly known as PPIs. These are medications like omeprazole and pantoprazole that reduce stomach acid. They're prescribed for reflux, acid damage, and ulcer protection, and they are extraordinarily common among seniors because acid reflux becomes more frequent after 60 as the digestive system changes. But PPIs do something most people never learn about at the pharmacy counter. They reduce the stomach acid that is necessary to release B12 from food. First, your body needs an acidic environment to break down the protein bonds that hold B12 in food. When that acid is reduced with a PPI for months and years, B12 absorption from diet drops significantly. A study published in the Annals of Internal Medicine followed over 25,000 patients on long-term PPI therapy and found that after 2 years of continuous use, PPI patients showed measurably lower B12 levels. After that finding, what do most doctors do? They recommend a B12 supplement, which makes sense on the surface. The problem is that in certain individuals, especially older adults with reduced kidney function, the B12 supplement isn't processed and cleared efficiently. It builds up in the blood in a form that interacts poorly with the homocysteine cycle we just talked about. But here's the part that's particularly concerning. Some patients on long-term PPI therapy develop something called rebound acid hypersecretion. This means that when they stop the medication, or even when the medication is metabolized overnight, the stomach produces excess acid as a compensatory response. During that rebound window, the high-dose B12 supplement is being processed in an unpredictable environment. Absorption becomes erratic, and erratic absorption means erratic homocysteine handling. Some days the system clears it, other days it doesn't. When was the last time your doctor specifically asked if you were taking a PPI and also B12 at the same time? Type never in the comments if the answer is never. I want to see that number because I think it will be sobering. Now, here's where everything we've covered comes together. The homocysteine connection is the heart of this entire problem. Homocysteine is one of those numbers that almost never shows up on a standard blood panel. Your doctor checks your cholesterol, your blood sugar, your thyroid, maybe your B12 level, but homocysteine requires a separate test and must be specifically ordered. The Cleveland Clinic has labeled elevated homocysteine as a significant and underestimated risk factor for cardiovascular disease in adults over 60. Yet most seniors have never had it tested in their lives. Here's why this is so important. When your homocysteine levels remain elevated for months and years, 3 things happen inside your cardiovascular system. First, the inner lining of your arteries becomes inflamed and starts to lose its natural smoothness. Second, Small oxidized LDL cholesterol particles find it easier to embed themselves into those inflamed walls and form plaques. Third, plaques that form in an inflamed, high homocysteine environment are more likely to rupture unstably, meaning they break off and travel through the bloodstream rather than staying put. That last point is what explains strokes in people who don't have major blockages on imaging. The plaque was there, it was unstable, and it broke off. Researchers at the Mayo Clinic have found that elevated homocysteine is present in a disproportionate number of these supposedly unexplained strokes. The cause wasn't mysterious. The right test was never ordered. This isn't meant to scare you needlessly. This is meant to give you knowledge that puts power back into your hands. And now that you understand what's happening inside the body, let me tell you what you can actually do about it. The answer is not to stop taking B12 altogether. B12 is genuinely essential, especially after 60. Deficiency causes nerve damage, fatigue, cognitive decline, and yes, cardiovascular risk of its own. The goal is not less B12. The goal is smarter B12. First, if you are taking metformin or a PPI, the single most important thing you can do right now is ask your doctor to test your homocysteine level and your active B12 level. Not just total B12 in the blood, but active B12, the form your body actually uses. Total B12 can look normal, while active B12 is low. This distinction is critical, and it's a distinction many standard tests pass over. Second, the form of B12 matters enormously. Most supplements on store shelves contain cyanocobalamin. It's the cheapest form to manufacture and requires your body to perform several conversion steps before it can be used. For seniors on metformin or PPIs, those conversion steps are often compromised. The form called methylcobalamin bypasses most of those steps. It's already in an active and usable state. Research published in the European Journal of Clinical Nutrition found that methylcobalamin raised functional B12 levels more reliably in older adults than cyanocobalamin at equivalent doses. Third, dosage matters more than most people realize. High-dose B12 supplements in the range of 1,000 to 5,000 micrograms daily are commonly sold and taken, but the body can only absorb a small fraction of that without intrinsic factor. The rest floods the blood in a form that can lead to the homocysteine imbalance we talked about. A more specific dose of 250 to 500 micrograms in the methylcobalamin form, taken with a combination of B6 and folate, gives the homocysteine cycle everything it needs to function properly without overwhelming the system. Fourth, speak specifically with your doctor about your medication list in relation to your supplements. Bring it to your next appointment as a specific agenda item, not as a passing question, but as the main topic. Say, I want to talk about my B12 supplementation in relation to the medications I'm taking. That conversation alone could change the trajectory of your cardiovascular health. Let me tell you about Beverly, because her story is one I want you to remember. Beverly was 74 and had been taking a PPI for 14 years and supplementing with B12 for the last 5 of those years. Her daughter had seen a video about homocysteine and heart health and dragged her mom along with a printout article. Beverly was skeptical. She felt fine. Her blood pressure was under control. She walked her dogs every day. Her homocysteine turned out to be 31 micromoles per liter. The safe range is under 15. At 31, she had more than double the level associated with significantly elevated stroke risk, and still no symptoms, no warning, no idea, just a number on a page explaining exactly why her arteries were working harder than they should. The form of the supplement was changed to methylcobalamin. Low-dose B6 and folate supplements were added to support the homocysteine conversion pathway. B12 was scheduled to be taken separate from the PPI dose to maximize absorption. A follow-up homocysteine test was scheduled for 90 days later. When Beverly returned 3 months later, her homocysteine had dropped to 17. It wasn't perfect yet, but it was moving in the right direction. She told me she didn't realize how tired she felt until she started feeling less tired. If you've been doing this for years, it's not too late. The body has a remarkable ability to recover and rebalance when given what it truly needs. The vascular inflammation that homocysteine causes isn't permanent when detected before a major event. Beverly proved that in 90 days. Here's her clear action plan. First, review your medications. Are you taking metformin for diabetes or a PPI like omeprazole for acid reflux? Second, review your B12 supplement. What form is it? If it says cyanocobalamin, you need to switch to methylcobalamin. Third, review your dosage. If you're taking over 1,000 micrograms, you're exceeding. Fourth, schedule a homocysteine test. Call your doctor tomorrow and specifically ask for a homocysteine level test along with active B12. Fifth, add B6 and folate support. These work synergistically with B12 to process homocysteine correctly. What you've learned today is this. Metformin and B12 create a dangerous interaction through the intrinsic factor pathway, leading to elevated homocysteine and arterial damage over time. Proton pump inhibitors reduce the acidic environment needed for B12 absorption and create an erratic processing environment that disrupts the homocysteine cycle. Homocysteine is almost never tested on a standard panel, and elevated levels in seniors are a significant, underestimated cause of strokes and cardiovascular events. The solution is not to stop B12, but to switch to methylcobalamin in a smarter dose with B6 and folate support. Comment below and tell me if you are taking metformin or a PPI and B12. I want to see how many of you this applies to. And if this video helped you understand a danger you didn't know existed, please share it with someone over 60 who is taking these medications. Your share could literally save someone from a stroke. Don't forget to like and subscribe for more evidence-based health information that your doctor simply doesn't have time to tell you in a 15-minute appointment. This is not medical advice. Always consult with your healthcare provider before making any changes to your supplement routine, especially if you are taking medications. Thank you for trusting me with your health education today. Now you know something that most people have never told you, and that knowledge belongs to the people you love too. Take care of your heart, and I'll see you in the next one.